You wake up, brew your coffee, turn on the TV, and have a small pastry, just like any other morning. But did you know that even a few small choices in the morning can affect your risk of stroke? As a brain specialist, I see this clearly. Every day. Many stroke patients have no idea that their seemingly harmless habits have been quietly building risk over the years. From how you use salt to sitting too long, lack of exercise, or even skipping breakfast, these can all lead to blood vessel problems, blood clots, or high blood pressure, which are major causes of stroke. Today's video will help you identify 10 dangerous behaviors and turn each day into an opportunity to prevent stroke instead of a hidden risk. We can't control everything, but you can control yourself, and today is the best day to start. The first point I want to share is about decoding your health numbers. When a doctor tells you your blood pressure is stable, many of us feel relieved and safe. But is that one number enough to guarantee your brain is protected from stroke? Or are we only looking at part of the picture, missing other important warning signs? Controlling blood pressure is extremely important and should never be overlooked. However, if we focus solely on blood pressure, we risk creating blind spots in prevention by underestimating the role of other factors like blood sugar and cholesterol, including LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Have you ever thought that messages about prevention are often oversimplified, making us believe that stable blood pressure alone is enough to avoid stroke? Our body is a complex system where many factors closely interact. High blood pressure damages vessel walls, but high blood sugar triggers inflammation and damage just as much, while bad cholesterol acts like waste, clogging the pipes of your blood vessels. So, are we just patching the holes caused by blood pressure while ignoring the cleanup of cholesterol waste or water quality control of blood sugar? Imagine stroke prevention like building a strong house. Good blood pressure is the solid foundation, but if the wall's blood vessels are damaged by high blood sugar and the plumbing cholesterol is clogged, is that house really safe? What I want to emphasize is that you need a comprehensive view of your health. Next time you see your doctor, instead of just asking about blood pressure, be bold and ask, what does the overall picture of my stroke risk look like based on my blood pressure, blood sugar, and cholesterol levels? What do these numbers mean, and what can I do to improve them and write a healthier story for myself? This is the crucial first step to help you actively protect your brain and reduce stroke risk in a complete way. Second, don't let medications become a burden on your journey to better health. Whether it's over-the-counter OTC drugs or treatments for chronic conditions, using medications always requires careful attention to avoid unwanted risks, especially the risk of stroke. OTC painkillers, especially NSAIDs, are easy to buy and work quickly, which makes many people feel comfortable and casual about using them. But that convenience hides hidden dangers, especially for older adults. Regular or high-dose use of NSAIDs can silently harm your heart and blood vessels, raise blood pressure, a leading cause of stroke, and increase the chance of blood clots forming. Even low-dose aspirin should only be taken when prescribed by a doctor. Taking higher doses on your own or combining aspirin with other NSAIDs without medical guidance can cause serious harm. For medications treating blood pressure, cholesterol, diabetes, or blood thinning, understanding and strictly following your doctor's instructions is absolutely crucial. A common mistake many make is stopping or changing doses when they feel better or worry about side effects. This is like removing your own protective shield, leaving your body vulnerable to dangerous complications. With chronic illnesses, taking your medications consistently, even when you feel stable, is the key to controlling your health numbers and preventing complications, including stroke. To stay safe, always tell your doctor about every medication you're taking, including OTC drugs. Using pill organizers or setting reminders can also help you maintain good medication habits, taking the right medicine at the right time to protect your health as effectively as possible. Third, screening for atrial fibrillation. AFib, an important step you should never skip. Have you ever felt your heart beating irregularly or experienced unexplained fatigue or shortness of breath? These vague signs could be early warnings of AFib, a dangerous heart rhythm disorder that often develops quietly without clear symptoms. So why is AFib especially concerning when it comes to stroke risk? With AFib, the atria, the upper chambers of your heart, don't contract effectively, but instead quiver, causing blood to pool and form clots. If a clot travels to the brain and blocks a blood vessel, it can lead to a serious stroke. Statistics show that people with AFib have a stroke risk 5 times higher than those without, and this risk grows as you age or if you have other factors like high blood pressure, diabetes, or heart disease. Fortunately, detecting this hidden enemy isn't difficult. AFib screening is usually done with an electrocardiogram, ECG, EKG, a simple painless test that helps doctors quickly spot abnormal heart rhythms. The key is not to wait until clear symptoms appear, because AFib can exist silently without you knowing. So be proactive in screening for AFib, especially if you're at higher risk or have experienced unexplained mild symptoms. Early detection allows you and your doctor to take timely steps to reduce stroke risk and protect your long-term health. Fourth, never underestimate a transient ischemic attack. TIA. Have you or a loved one ever suddenly experienced one side of the face, drooping weakness in an arm, or difficulty speaking for just a few minutes before everything returned to normal? Many people easily dismiss these signs as fleeting fatigue, but this is a dangerous misconception. These brief symptoms are warnings from your brain a transient ischemic attack, also known as a mini-stroke. TIA is a critical warning signal. Although symptoms may disappear quickly without causing permanent damage, at that moment, they signal a high risk of a serious stroke occurring soon, possibly within days or weeks. Ignoring a TIA is like ignoring a life-threatening alarm. If you suspect someone is showing signs of TIA or stroke, use the FAST method to recognize it quickly. F. Face drooping. Check if one side of the face droops when they smile. Arm weakness. Ask them to raise both arms and see if one arm drifts downward. SSS. Speech difficulty. Listen for slurred or strange speech. Ask them to repeat a simple sentence. Better T. Time to call 911. Time is precious. Call emergency services immediately. Don't hesitate or wait to see if symptoms go away, and never drive yourself to the hospital. Every second counts. Even if symptoms disappear by the time medical help arrives, it's crucial to get checked to determine the cause of the TIA and receive proper treatment to prevent a more severe stroke. Always remember, time is brain, and quick action can save your life or that of a loved one. Fifth, regular physical activity. A vital habit that many older adults often overlook, but plays a key role in reducing stroke risk. You might think that age or aches and pains keep you from being active, but in reality, maintaining appropriate physical activity is a smart way to preserve your health. Physical activity doesn't have to mean intense workouts or professional sports. Smart movement means finding activities that suit your condition, bring you joy, and can be done consistently. The main goal is to reduce sedentary time, boost blood circulation, improve heart health, and help control blood pressure, weight, and blood sugar. All important factors in stroke prevention. These smart activities can be simple, leisurely morning walks, gardening, gentle dancing, or household chores. Even small choices like taking the stairs instead of the elevator or walking a few extra minutes adds significant benefits. The most important thing is to keep a regular exercise routine that you enjoy. Start with small, manageable goals and gradually increase over time. Inviting friends to join walks or gentle exercise groups can boost your motivation. Don't let the thought "I'm too old" hold you back. Every step you take is an important move toward better health, improved mobility, and lower stroke risk. Sixth, the secret to stroke prevention lies right on your plate. Have you ever truly thought about how what you eat every day affects your brain health? Many people believe preventing illness is simply about cutting salt or reducing sugar. While that's true, it's not enough to build a complete shield against stroke. Your plate can become a strong fortress if you learn to choose foods wisely. Beyond limiting salt and sugar, there are other dietary saboteurs you need to watch for, such as saturated fats and trans fats found in fast food processed items and fatty red meats. At the same time, a lack of fresh vegetables and fruits, rich sources of vitamins, minerals, and fiber reduces your body's ability to protect your heart and brain. So what does a brain-protecting diet look like? Prioritize colorful meals full of fresh vegetables and fruits, whole grains instead of refined ones, and fatty fish, like salmon and mackerel rich in omega-3s that reduce inflammation and improve heart health. Beans and nuts are also great nutritional additions. Diets like the Mediterranean and DASH, dietary approaches to stop hypertension. Follow these principles, helping control blood pressure, cholesterol, and blood sugar while providing antioxidants that protect brain cells from damage. Instead of just focusing on cutting out unhealthy foods, pay attention to adding in plenty of nutritious foods. Aim to eat a rainbow daily variety of colorful fruits and vegetables, since each color often contains unique and important nutrients. Try new recipes, explore healthy flavors, and enjoy the joy of cooking at home. This is the sixth golden key you can hold right in your kitchen to protect your brain health and effectively reduce your stroke risk. Seventh, drinking enough water. A simple habit that's extremely important for protecting brain health and preventing stroke. Do you drink water regularly throughout the day or only when you feel thirsty? This matters because water is the essential life source for every function in your body. Why is staying hydrated so important? Even mild dehydration makes your blood thicker and stickier than normal. This raises the risk of blood clots, forming one of the main causes of stroke from blocked brain arteries. Dehydration can also affect your blood pressure, making it unstable and putting extra strain on your circulatory system. A key fact is that older adults often experience a reduced sense of thirst, making them prone to dehydration without realizing it. That's why proactively drinking water regularly, even before you feel thirsty, is crucial to keeping your body's fluid balance. And when I say water, I mean pure plain water, not sugary. Drinks, soda, coffee, or tea, since some of these can actually cause more dehydration. How can you tell if you're drinking enough? Pay attention to the color of your urine. If it's pale yellow or nearly clear, that's a sign you're well hydrated. Dark yellow urine signals dehydration. To be safe, aim for about 8 glasses of water a day as a reasonable starting point. Keep a water bottle nearby as a reminder, set regular alarms to drink, or make it a habit to drink a glass. Right when you wake up and before meals. Never underestimate the amazing power of water. It's your essential companion in keeping your brain healthy and lowering your risk of stroke. 8th, sleep quality. A crucial factor often overlooked but with a big impact on brain health and stroke risk. Do you often feel tired even after waking up, have trouble falling asleep, toss and turn, or wake up multiple times during the night? Sleep isn't just rest, it's the golden time, when your brain cleans, repairs, and restores vital functions. So what's the link between sleep and stroke? Chronic lack of sleep can raise blood pressure, though one of the top stroke risk factors. Poor or insufficient sleep also triggers inflammation and damages blood vessel walls, weakening your circulation, especially sleep apnea. A condition where your airway repeatedly blocks during sleep is a hidden enemy that stresses the heart and raises the risk of high blood pressure, atrial fibrillation, and stroke. How can you get truly restorative sleep? Build healthy sleep hygiene habits, go to bed, and wake up at the same time every day. Create a quiet, dark, cool sleep environment. Limit screen time before bed. Avoid heavy meals, caffeine, or alcohol close to bedtime to prevent sleep disruption. If you often snore loudly, experience breathing pauses during sleep, or feel excessively sleepy during the day despite enough sleep, see a doctor. These could be signs of sleep apnea. Timely diagnosis and treatment, often with a CPAP breathing device, can greatly improve health and reduce stroke risk. Think of sleep not just as a need, but as a vital investment in your brain's safety and long-term health. 9th, the surprising link between social health and your stroke risk. Do you often spend time with family friends or participate in community activities? Or do you feel lonely and have little interaction with others? Many people don't realize how deeply social health affects stroke risk, but research shows that loneliness and social isolation significantly increase the chance of having a stroke. Why is this? Prolonged loneliness leads to chronic stress and depression, both of which negatively impact heart health and blood pressure. People who are lonely also tend to take poorer care of themselves and are more likely to develop unhealthy habits like irregular eating, lack of exercise, and smoking. Even more importantly, living alone with limited social contact means that if stroke symptoms occur timely, medical help might be delayed, raising the risk of serious complications. On the other hand, maintaining positive social relationships and feeling connected brings clear benefits. It reduces stress, improves mood, and encourages healthier lifestyle choices. Having friends to walk with, family to share meals, or someone to talk to acts like a valuable mental boost. So how can you stay connected? Actively nurture and maintain relationships around you. Spend quality time with family and friends, join clubs, classes, or volunteer activities. Even a friendly phone call can make a big difference. Don't hesitate to seek help or share your feelings when you feel lonely. The power of human connection isn't just joy, it's a shield that protects your heart and brain health. 10th, the hidden stroke enemy lurking on food labels. Do you often carefully read the nutrition facts on product labels before buying, or do you just glance at the name and pictures? If you're in the latter group, you might be unknowingly bringing home health saboteurs that harm your brain. Large amounts of sodium, salt, and sugar are often cleverly disguised in processed foods. Canned goods, sauces, sweets, and drinks you consume daily. Why is unmasking hidden sodium and sugar so important for stroke prevention? Excess sodium is the leading cause of high blood pressure, the biggest risk factor for stroke. Meanwhile, consuming too much sugar, especially refined and added sugars, can lead to weight gain, obesity, insulin resistance, and type 2 diabetes, all of which significantly increase the risk of heart disease and stroke. To become a smart shopper and decode food labels, pay attention to these key areas. First, check the serving size. All nutrition info on the label is based on this amount, so you need to know how many servings are in the package to calculate how much you're really eating. Next, look for sodium. When comparing similar products, choose those with lower sodium to protect your blood pressure and blood vessels. Finally, don't forget total sugars and especially added sugars. Added sugars are those put in during processing, and these are the ones you want to limit as much as possible for your health. Watch the next video where I'll guide you on how to spot the earliest warning signs on food labels, helping you protect your brain health more effectively right from the grocery store.